homologous anatomy secret. Okay, we're looking at homologous anatomy secret. Okay, that's what we're looking at today. Homologous anatomy secret. Okay, why are we looking at homologous anatomy secret? Because the word homologous means structures that have similar origin, okay, in which their appearance or their function may be different. Okay, their appearance and their functions may be different. So, but their origin is the same. They have the same. They come from the same place, but their function may be different. Now, most of the time, their function may not be different. Okay, the function may be the same. All right, and their appearance may be the same. Okay, but if their origin is not the same, we say that's analogous. Analogous. But we are not here to learn English. We are here to learn secrets. All right, meaning what do we mean? If you know one thing, all right, it should be able to give you a clue to knowing the other one. Do you follow? Do you follow? Good. That's what we mean. If you know one thing, it should be able to give you a clue to know the other one. All right. So I need to rise up and share with you this concept because I notice when I sit down, I get tired because I've been doing this over and over. So when I stand up, I have a lot to share with you. Do you follow? Okay. So thank you very much. Now, it's been a day we've been waiting for. We're really planning so much in very short session. This session is not going to take so long a time. It's just going to take just a short period and then we'll hit it because we are going to raise another one for thorax. We are going to raise another one for head and neck. Do you follow? Yeah. Okay. So okay. All right. So we are still on this, and that is homologous anatomy secret. What does that mean? Let's speak, for example, here is a structure of anatomy. You can see the structure here. You see the shoulder girdle, or what you call pectoral girdle. Okay. Now, in upper limb, there is pectoral girdle, and it has things it is made up of, two bones. Now, when you look at the lower limb, you talk about the pelvic girdle. Talk about the pelvic girdle. All right. So that's connection. That's a secret. You don't learn in singleton. You learn, okay, in connection. Now, the next one worth considering is watch this closely. I think I need to fix just one important thing. The next one is you see there is a scapula and clavicle. That's what makes up the shoulder girdle. All right. Now, but here, we talk about the pelvis girdle. And what makes up the pelvis girdle? The ilium, the ischium, and the pubis. The ilium, the ischium, and the pubis. That's what makes up the pelvic girdle. All right. We call that bone inanimate bone. Inanimate bone. It makes up of more than one bone to form that girdle. All right. Now look at the humerus. You see the humerus. You see your body is the first. Okay, and between the shoulder rather and the elbow. That is the humerus. This humerus is homologous. All right. That is it's similar in origin. All right, to the femur. Can I also say this? Respect to function and appearance, it is analogous. That is, they have similar function and similar appearance, but in terms of origin, they are homologous. They come from the same human being. They come from the same Asia skeleton. Do you follow? Now, as we are saying this, I'm going to reduce this and then quickly now go to the outline for discussing them. Outline for discussing them. So if you want to discuss the anatomy of shoulder joint or the anatomy of the hip joint, okay, or the anatomy of the knee joint compared to elbow joint. This is what we call homologous now. Homologous in origin, analogous in function, and in appearance. They appear in similar place when compared together. They appeared in similar place. Okay, this is how you prepare for your exam. If you listen this to the end, you're going to find every secret aside from just pick here, pick here. You're going to see how we discuss a certain bone, and then you use that same pattern, okay, to discuss every other bone anywhere in anatomy, not just in upper limb or lower limb, not just in thorax, abdomen, and pelvis and perineum, even in head and neck. Wherever you find the bone, you have to discuss considering these subtopics, this outline. Okay, now moving away from there, we said, I'm going to be very practical with you, very practical with you. Look at it, we've talked about the girdles, pectoral girdle, upper limb, pelvic girdle, lower limb. You can see it. All right. Pectoral girdle make up of bones, clavicle. Okay, is the clavicle, right? I think I have the bone here. You can see the clavicle. All right. You have a clavicle bone. You have the clavicle bone. All right. And then you have the scapula. Did I come with scapula here? All right. So those two bone makes up. So at least you can see it here. All right. Now that's about the Gido. So this is homologous. Now you may say homologous is strange a word to me. No, it shouldn't be strange. You homologous series, okay, in biochemistry. Come from the same family, the same origin. They give birth to them the same, they have the same parent name, the same ending, the same aiming. Do you follow? Now, that's the secret you use it when you study in connection. It makes it last longer, it makes it last for. Okay, so we move on. We now talk about, we are done with the girdles, the pectoral girdle, upper limb, the pelvic girdle, lower limb. The pelvic girdle is made up of the innominate bone, all right, as the ischium. Okay, that's the base, and that's the ilium. That's the pelvic girdle. Now let's talk about the bones. All right. But do we start with bones or do we start with joints? Whichever. All right. Now what comes there first is the joint. Before the joint, something forms the joints, and that's the bones. The clavicle and the scapula forms the bones of the pectoral girdle. So meaning we start with bones. When you look at the bones, all right, and you look at the bones very specifically, the shoulder bone, all right, the shoulder bone is homologous to the ilium. The shoulder bone is homologous to the ilium. Now, the ischium and the pubis is homologous to the clavicle. We say the clavicle is the only horizontal bone. The only horizontal bone. Look at this now. So I don't know if you are close to cadaver or you're closing your holiday, you can look for a bone. You can get to the bone. Try to check. Can you find a clavicle? All right. Moving away from there, we said we have, remember the clavicle is the collarbone and the scapula is the shoulder bone, or the shoulder blade. Now, moving away from there, we say bones. All right. I'm going to give you, like, once again, the structure for discussing bone. Okay. So, how many bones do we have? Now, look at this picture very closely. The bones of the upper limb. You have the scapula. Okay. Let's start from clavicle. You have the clavicle. You have the scapula. You have the humerus. Okay. You have the radius. You have the ulna. You have the carpus. There are 8. You have the metacarpals, there are 5. You have the phalanges, there are 14. But in groups of what? 1, 5, 6, 7, 8. Okay, that's not group. In groups of 1, 2, 3, 4, 5, 6. Groups of 6. Groups of 6. All right, that's groups of 6. But they are what? Watch this now. They are groups of 6, but they are what? Uh, I think we need a little light. Okay. It's on a little light. So you see my mouth very clearly. Okay. So we are making progress. So that's groups of 6. Now let's look at the lower limb. Let's look at the lower limb. We have what? Group of the phalanges: 1, 2, 3, 4, 5, 6. 6 also. You see now? 6 upper limb, 6 lower limb. So the whole of 100 and something bones or 60 something pairs of bones is reduced to six. Can you imagine that? All those bones. I think 6 weeks in a certain school, when I was examining their course at night, in a certain school, 6 weeks is devoted for just bones alone. Can you imagine that? Can you imagine that? Now, that's in total, there were 13 topics on bone out of the 48 topics. So, how do you manage this for your exams coming up very shortly? Okay, this is how you do it. You must know just 6 things to study. Okay, and these 6 things is further reduced to one sentence. You just need to know one sentence. Come on, you need to give a subscribe, you need to like, you need to share, you need to send this across, okay, to people who are struggling. There's too many materials to study, to appreciate, to understand. Very important. Okay, you need to share this. You need to, if you are finding value, because I'm going to show you one sentence you need to learn. In fact, you need to sing it, you need to share, you need to discuss it, you need to think about it, you need to write it out, paste it in your plate, paste it in your convenience, paste it in your um, under your bed, or paste it in your mirror, paste it wherever. Okay, you can even put it in your wallet. You can put it in your wallet. Each time you remove it, you see one sentence that you need to know to understand everything, to answer questions, ace your whatever in bones. The same thing with joints. But taking those two this afternoon, but I'm going to give you in the next video called anatomy table of values. Okay, complete anatomy table of values. But before we come to that complete anatomy table of values, we're going to look at, because there are many, 17 of them, we are going to look at them in badges and in faces. Do you follow? In badges and in faces. This is just 11 minutes to this. We promise in this session. So we can pick thorax, abdomen, and perineum. We can also pick head and neck. So after this session, just check the channel again. You're going to see we are going to get into thorax immediately. And then after that, sorry, we're going to go to head and neck immediately. After that, we get into thorax, very importantly, because as you do one, we do another. And then in the night by 9 p.m., don't forget, in the night by 9 p.m., we are looking at physiology. We're looking at physiology. We are looking at physiology to help. We have over 45,000 hungry students, okay, who have sent message to us. Please make video on this. We need a simpler approach to this. And guess what? We still have about 28,000 that are looking for video on brachial anatomy, on brachial plexus, okay. And we are still thinking of how best to be able to present this so that it will be simplified, just like we are doing for lower and upper limb homologous and analogous structures. Okay, so this now, let's quickly look at something. Okay, the secrets now. Watch this. Structural homology. Okay, shoulder, that is pelvic girdle. All right, pelvic girdle that corresponds shoulder girdle or pectoral girdle. Pectoral girdle correspond with pelvic girdle. I've already said that. Now the arm correspond with thigh. Okay, the forearm correspond with the leg. The hand correspond with the foot. Do you follow? That's just that. That's homologous in pairs. We call it comparative study. You study in comparison. All right, move to the next one. Talk about the key joints. All right, that is the ball and socket joint of the shoulder, flexibility, as well as the hip joint for stability. Okay, ball and socket joint. Okay, now see the difference: stability and flexibility. Not that the ball and socket joint is not stable, but it's more flexible than the hip joint. This is what we homologous, different in function. We say it may be different in function, but it is the same in origin. They come from the same axial skeleton, the same thoracic skeleton. Do you follow? Because we said the human body is made up of two skeletons. That is the appendicular skeleton and the axial skeleton. The appendicular skeleton, okay, have the ancestry of the axial skeleton. Okay, wow, today I feel good. I'm not feeling tired as usual. So we have a whole lot to learn. Do you follow? Thumbs up if you are with me. Now we move on. All right. We have there the function, manipulation, and stability. As the leg can manipulate, just like the shoulder can manipulate. Both are stable in their movement or manipulation or their direction. Okay, both are. Now let's look at the nerve plexus. This is what I was telling you. The brachial plexus and the lumbosacral plexus. Okay, many want us to do video on that because it's I mean, you are in doing anatomy and you don't understand brachial plexus. That's a slap. Okay, that's a slap. Okay, now that's where you hear something like my uncle respects my auntie. You need to understand that. Don't worry, we are coming there. And then we move to blood supply. Okay, you see the subclavian. I'm getting serious now because this way you find anastomosis. Okay, it's like somebody say, which one is anastomosis again? Don't let that scare you. Anastomosis is just a network. It's just like saying joint. Now, but this joint is not for bone to bone. This joint is for artery to artery. It could also be nerve to nerve. Are you following? It can also be nerve to nerve. Just as you talk about the brachial plexus, you can also talk about, okay, the brachial axis. And that one we call anastomosis of the elbow. All right, so we move on. We have common iliac, external iliac, femoral, popliteal, and tibia. What that tells you is that as we talk about the upper and lower limb, the blood supply, the arteries supplying those structure in the upper limb include subclavian artery, axillary artery, brachial artery, radial artery, and ulnar artery. The subclavian and the axillary supply the scapula. Okay, that's the pectoral region, whereas the brachial supplies the humerus. Okay, because humerus is also called brachium. All right, radial and ulnar artery supplies the radius and the ulnar bone. You follow? Like that, like that. Okay. Talk about the common iliac external. So you see how simple it is? Not difficult. Okay, very simple. One, two, three, we are done. One, two, three, we are done. The joints, the girdle, the nerve, the artery, and that's all. That's all. Is that difficult? That's not difficult. So very quickly, we've done 16 minutes. So we use the remaining 14 minutes to quickly look at the outline for discussing joint and bone. The outline for discussing joint and bone. You know, I was going through a material. This is secret now. Thumbs up if you want to hear this. I was going through a secret now, and I discovered many examination body, not just in one school, not just in one institution, they are now moving away from origin and insertion, okay, to asking related areas, simple related areas. That is what? That is number one, the clinical relevance, what you call clinical significance or applied anatomy of a certain concept. So if they are talking about bone, they cannot, they, yes, they may want you to write using outline, and one of those things may be muscle, maybe the muscle that are attached to the bone or muscle that are attached to the joints. Okay, but guess what? They are not really interested in the origin and insertion when you are listing the muscle. They are after what's the clinical significance of that joint, what's the clinical significance of that muscle, sorry, of that bone. What that means is what will bring someone to your clinic. How significant is your clinic to that person's bone? Is when the bone have issue. So what are those issues? Do you follow? Now the applied anatomy. How is it supposed to work? Once the function, this is what they ask the anatomy student and physiology student. For the preclinicians or the parapreclinicians, like the medicine, like the nursing, like the pharmacy, do you follow? They ask them what are the malfunctions, not the proper function, not the anatomical application or applied anatomy, but the clinical significance of that structure. So now there's something I want to hit you here because we have less than 10 minutes, okay, or 12 minutes to end this session. All right, simple, straightforward, short. We tell you about this. We tell you about this. I relates to this. We tell you about the basic things you need to pick up, and then we are about to use the remaining time to tell you about one sentence, just one sentence that you need to understand joint and bones. And then when we are done, we'll zoom it down, okay, into what? Arterial anastomosis and nerve anastomosis. Okay, that is brachial plexus as the nerves of the brachium, all right, and then the anatomic anastomosis of the artery, the arterial network of nerves, network of arteries. Those are the two extra things we'll be looking at. Do you follow? If you can appreciate this in upper and lower limb, bro, guy, you really hit a jackpot. Really hit a jackpot. There's a lot more we need to do depending on the needs, okay, expected of us for upper and lower limb. But come on, this is the basis you need to know. You know this, you are good to go. All right? Nerves, okay, dermatomes, all right, arteries, you're good, okay. And then someone say, muscle, there are a lot of, don't worry, we are trying to demystify. So enough of talk, let's get quickly to what we need to do before we go. All right, look at this. Have you seen this? Let me pick this down here. Okay, you seen that? That is anatomy table of values for bones of the lower limb. You can see the bones of the lower limb. You see it? 1, 2, 3, 1, 2, 3, 4. Oh, I think I need to do another one because the is not here. The hip bone is here. They replace the hip bone. Oh, that's a little mistake. Okay, I can't find the material now. But I'll send on a shot the one that has the hip bone. Right? Remember we said the hip bone is the innominate bone. That bone contains the ilium, the ischium, and the pubis. We call it ipi. Okay, or ipi. Okay, IPI. I for ilium, P for pubis, and S for ischium. Okay, so the important thing I want you to pick here is this one sentence. You know, I've promised you this one sentence. If you know this one sentence, you know what they stand for. That's it. You know the one sentence, that's it. You can write any exams on any bone. All right, any bone. So I'm going to do this for a few seconds into a minute. Please thumbs up if this is making sense. I sometimes draw some perfect picture showing some big mysterious brown lion of Jasper Field, excluding sparkling cities. Count. You know, people need so many outlines to write. Yes, so many, but sound as well, not just so many. You can write so much and it means nonsense. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. 18 different outlines for discussing bones. Watch. I draw, I sometimes draw sometimes draw some perfect pictures. Did you see? Say it. You need to do this over and over like we used to practice because I don't want to keep this video long. This thing you need to say it over and over. Share with your studying partner. Say it. Okay, when you wake up, say it. Like I said, write it out. Sing it. Say it. Listen to the audio. Let it be your play. You know, get to the shot. I've promised this shot for a whole lot of videos now, but because I want to give you the best. Okay, I want to just like I give you the 17, this in the 17, go check, you know, the one that contains all the 40 something topics and over, we reduce it to 17 topics using a simple keyword. Okay, please never ask very old student question. Okay, many fear comprehensive joint body exam because brachial anatomy feels something like that. So this sentence when you're discussing bones of the upper limb, it's the same sentence you use to discuss bones of the lower limb. This same word, this same sentence. He said, I sometimes draw some perfect pictures showing some big mysterious lions on Jasper's field, excluding sparkling cities. Let's put it again. I, so, I sometimes draw some perfect pictures showing some big mysterious lions on Jasper Field, excluding sparkling cities. Can you imagine that? On Jasper Field, excluding sparkling city. That's the sentence. I stands for, you can see what it stands for. Can see what it stands for. I'm still checking my time because I don't want to keep this video long. Very short and straight and simple. Homologous anatomy secret. Comparing the upper and the lower limb. So this is for the lower limb. Let's quickly look at the upper limb. Can see at the upper limb, very interesting. All the 6 groups of bones we talked about: phalanges, metacarpals, carpal bones or carpus, radius and ulnar, humerus, scapula, and clavicle. That's the 6 pairs of bone. This one gives you all the bone. Now, I'm going to make another series as if I've not already dropped in the group. I think I've taught that before in Google Meeting, but I don't think I've dropped it for the wider audience, the whole world. We have millions of students are crying. They are praying, God, how will I do the exams? Exam is next week. Exam is in 4 to 5 days. There's something I just need to tidy up. Yes, I understand a little bit about any other. This issue of bones, if I'm asked to deal with bones, you may think because you understand bones, every other person in the whole world understand bones. No. So share this video, subscribe and like so it will reach out. When we are making video or any other simple talk, we need to be here because you don't know who is going to be in the hospital, okay, to treat your loved one or to even treat you. I'm not praying anything should happen to you or your loved one, but we need to make the world a better place. We need to see how much we could do to help people understand this concept as we too are trying to understand. See, it's the same sentence. I sometimes draw, okay, some perfect picture showing big, mysterious, okay, brown lion on Jasper Field and City. Same sentence, okay, and same outline. This sentence stands for the same thing. I for introduction, sometimes for size, draw for diagram, perfect for path, some for shade, picture for position, showing for surface, some for side dictation. So see where I read it and stop, and see where I add again. So that's what you read the first one, stop. Read again, stop. Now add the next one, stop. Read again, stop. Now read the next three, stop. The next three groups of words, stop. And then pick a book, write it out, stop. And then look at it again where you make mistake, stop. You recall again, you recite again, stop. You pick a book again, you write again, stop. And then you test yourself again. These are some of the secret, the things you need to watch that video. Good news from anatomy. Things I wish I knew in anatomy. Things I wish I knew from anatomy, good student, anatomy, failure student, anatomy distinction. We've done that. And one of those things is test yourself. Once you think you claim you've read, test yourself. So there's no point carrying so many books, big books, opening, scaring structure, and you cannot say, what did I even read? Come on, you cannot even ask yourself a single question. Can I really recall what I read? Can I really recall what I read? You need to ask yourself such questions. Do you follow? Thumbs up if you are with me. So just before we close, we have about 4 minutes to end this session. Here's what I want to put to you. You follow? I sometimes draw some perfect pictures. So you say that again. Now, you now say from that to the next one. I sometimes draw some perfect pictures. Okay? You said that. Now pick a book, write it out. See the one you miss. Pause this, pick a book, write it down. Then continue again. I sometimes draw some perfect pictures. Okay, say it with your mind, then before you check it up, or check it up, then say it with your mouth, then try writing it out. Try writing it out again. I sometimes draw some perfect pictures, okay, showing some big, mysterious, okay, brown lion, okay, on Jasper Field, excluding sparkling cities. The same thing. You say it over again, you close it, you go and write it out after you read it out. Gone are those days they say read in your mind. Well, you may read in your mind if you are calm, nothing troubling you, nothing distracting you, nothing, bugging you. But we live in a world either entertainment or endurance, distract. So you need to say it out. Give it a voice if it must be a voice tomorrow and not remain a noise. Okay, we move on. The next thing we want to look at, very important, very, very important. And what is that? Mm, what it stands for. Okay, what it stands for. The same way we deal with what the one sentence for anatomy of upper limb, the one sentence for anatomy. This is just for what? For bones. This is for bones. The same thing goes for joints. So, like I promised, I'm going to send for joint. Give a like. Give it. If I see your like, I give you, see your comments. If you really need the one for joints, okay, we have the one for muscle, we have the one for other concepts. So if you really need it, send a thumbs up and we give you beautiful sentence, all right, on this beautiful mnemonics on this. Okay, so once again, thank you very much for being a part of this session. It's been a wonderful time. We said I sometimes draw some specific. Okay, so maybe I will quickly look at for joy. I think I have a few minutes remaining. Let me quickly look. A few minutes, that's 2 minutes remaining. We quickly look at the one for joints. So very I didn't want to hit our time, so you can see this is for muscles. Oh no, this is not for muscle. These are the 17. Okay, because of our time, okay, I'm going to make another short one for the joint and for the muscles. This is only for, we zoom this one down to a certain muscle on a certain bone. Is that okay? So please, thank you very much for being part of this session. It's a wonderful time. I believe you have gained some. Drop in the comment section if this video has been of immense help to you. Okay, let's know. And what do you feel we should summarize and send to you in a very easy way? Let's get to know. Now, I'm rushing on this. When you are studying it, you study, you pause. When you are watching it, you watch a little, you pause. Take your eyes off. And that's they say is good for our eye health, the health of our eyes. Okay? Yeah, the health of our eyes. I'm using this because I have a lot of light coming through my eyes up to block some. So now watch this now. We said when you look at it a little, you take your eyes off. What did I remember? What did I just read? Things like that. Do you follow? All right, thank you very much. See you again in thorax. Just shortly, we'll start thorax now.